Look at our records. They look at our training records from our training as aircraft technicians through the company. They look at our tooling to make sure it's been calibrated. They look at the aircraft for the cleanness and the shape that it's in. Yeah, the FAA has one set of standards, and CAMES goes a step above that. They have different issues that go above and beyond what the FAA does. And we have to abide by those too. And like I said, they came through and they look at us from top to bottom. They look at our facilities. They look at our tooling. They look at our inspection program. The mechanics are on call 24 hours a day. And we don't let anything go maintenance-wise. Well, what we do, I think, is very important to the flight, because if we're not doing our job, the aircraft doesn't fly. When the aircraft doesn't fly, they're not out saving lives. So it's our job to keep the aircraft in very, very good shape, to keep our downtime to a very, very low minimum as much as possible. But these are mechanical things, and they break. And when they do, we have to fix them. Sometimes we're here 20 hours a day to fix them. Sometimes we're not. Sometimes we can get it fixed pretty quick. But the availability of the aircraft is the key, because they can't fly if the aircraft isn't flyable, isn't airworthy.
You know, I wasn't at the field. I was about a mile away coaching another one of my son's games, and my phone rang as I was coming off the field, and I looked down at it and saw that it was Cole's coach. And I thought, boy, that's odd. He's calling me in the middle of a baseball game. So I decided to answer the phone, and he said, Scott, I don't mean to alarm you, but Cole's been hit in the head with the line drive while he was pitching, and he said he's conscious and awake, but we've called 911 as a precaution, and we're going to take him to the local community hospital, Bethesda, as a precaution.
Well, from the accident, I remember laying on the ground and looking up at my coach, Rob Walker, and I also remember I remember laying there on the ground and looking over towards where the road was, and I saw the ambulance, and I was thinking, why can't I just get back up and play?
So we were actually at a PR event at a local fire department, showing the helicopter and kind of just talking to the crew about what we were doing when we got toned out for this flight. And so we jumped into the helicopter quickly and flew to the ball field, and all we knew en route was that it was a 14-year-old struck in the head.
There was a neuro nurse on the field who immediately demanded that they call air care, even though Cole was conscious and awake and walking around for 5 minutes. Paramedics showed up within 4 minutes, and that air care had been called within 8.
Whenever you're dealing with a child, it still kind of raises the bar a little bit. You get a little bit more anxious, and you're kind of waiting to see what you're going to come across. It's just that much more important. When we landed on the field, we were escorted to the back of the ambulance where the patient already was. And just from hearing the brief story from the ground crew, we knew we were dealing with a pretty significant injury at this point.
He wasn't talking to us. He wasn't, the motor exam that he was presenting to us told us right away that this is a significant head injury.
About 5 minutes into my drive towards Bethesda Hospital, I got the call from my wife saying that Cole had been basically spiraling downward in terms of his condition.
So we acted quickly to help prevent any further seizures, as Cole, prior to this, had decompensated very quickly. He was struck in the head with a baseball. He was able to walk off the field. In the interim, his mental status decompensated very quickly to where he lost consciousness, had a seizure, and was not in very good shape at that point.
I raced to Children's. I actually got there before the helicopter did, and I had talked to the trauma team before he came down the elevator and knew exactly what was going to happen, which was essentially a very quick assessment, and then they were going to rush him in for a CT scan to find out if he had any intracranial bleeding, which I was pretty confident he did.
Sally and I worked quickly to give him some medication to help prevent further seizures. We evaluated him. We knew that we needed to essentially take control of his airway so we could breathe for him and make sure that he would not aspirate any vomit or anything else that might happen. We gave him some medications to make sure that he was fully asleep, and we paralyzed him at that point so we could place the breathing tube into his trachea. And at that point, the ground crew, the Loveland Sims Fire Department, had done a great job of already pretty much packaging him, getting ready for transport. So we were able to quickly move him to the back of the helicopter, get him loaded in the helicopter, and continue our care from there.
The teamwork that took place within that medic unit, I love flying with Tom. We get along really well. So I was pushing drugs, and we didn't really need to communicate. There wasn't a lot of verbal communication. And, each one of us knew what needed to be done. And the Loveland Sims guys, whatever we needed, everything was done like that. Everything was so succinct and precise, and nothing needed to be said twice.
And our care in flight really dealt with reducing any further injury that his brain might have suffered or would suffer. And so that deals with making sure it's getting enough oxygen, making sure that the pressure within the skull is not increasing too much, making sure that the blood supply to the brain is adequate. Simple things as much as just lifting the head of his bed to make sure the head is draining properly, to giving him medications to make sure he's nice and sedate and not agitated and not in any pain. That was all performed en route. We gave him some fluid to make sure that he had enough blood pressure to perfuse his head, and transferred him to the local children's trauma center, where we were able to give over his care to the emergency department staff and the trauma staff who were waiting for him.
They said if he had bleeding, they were going to rush him immediately to surgery to try and basically, remove the pressure from his brain and get the blood clot cleaned up. So everything happened very quickly, and it was, certainly an overwhelming period of time for us. Cole was in a coma. He had surgery on Sunday afternoon, the 17th, and the first time that he actually started to become conscious was probably Wednesday of that week, which would have been, the 20th.
Well, he told me that I had been injured in a baseball accident, and then I remembered my baseball game and laying there on the field. I had to go to therapy 8 hours a day. There were 4 different kinds of therapy: recreational, physical, occupational, and speech. And I had to go to those twice each day for an hour, 2 hours each.
Yeah, 1 hour of each in the morning and 1 hour of each in the afternoon.
Mm-hmm. Yeah, thank you.
So it was a busy day.
Yeah.
I think a good starting point is to maybe share with you the story of what happened the first night that he really became cognizant of what had happened and how seriously he had been injured. And it wasn't as soon as he thought. He essentially had no short-term memory for the first 3 weeks that he was in the hospital. I mean, he couldn't remember what he had for lunch 5 minutes later. But one night in June, it was about 10 o'clock, and Cole got up to go to the restroom, and I helped him into the restroom. And when he came back out, he looked in the mirror, and he was wearing a helmet. And he didn't say a word, but he unsnapped his helmet, and he looked at his head, and he had a severe depression from where his skull was missing. And he put his helmet back on, and he went back into his bed. And about 5 minutes later, he looked at me and he said, "Dad, I'm never going to have a normal life again, am I?" And I swallowed really hard when I heard that, because I figured that at some point he was going to start asking those types of questions. And I said, "Cole, I disagree with that." And he said, "Well, do you want to explain to me how that's going to ever be possible?" And I said, "Well, my perspective is, if you work very hard to recover everything that you've lost from a physical perspective, and you're able to regain everything that you've lost from a cognitive standpoint, you'll be back to who you were. But what's going to make you a better person is this incredible experience that you're going to have gone through that's taught you so much about inner strength and persistence and just overall determination. And I said, if you get through that and you regain everything that you've lost, you're going to be a stronger and different and better person than you were before in ways